So, hello, Dr. Dr. Blooming. It's right, Blooming, right?
That's correct.
Avrum, I will call you. So, we spoke about the WHI and HRT. We've spoken about osteoporosis. Now I need to ask you about HRT and the heart, because there is a lot of contradictory information out there. Is HRT, good for the heart? Does it do nothing for the heart? Here's my anecdotal evidence. This is what happened to me recently. So, 2016, I had recently had my uterus out. I go to a cardiologist with heartbeats that felt irregular. She puts me on a Holter monitor for a month. I'm diagnosed with PVCs. Um, what is that called?
Premature ventricular
Ventricular.
contractions.
Yes, that. And she puts me on metoprolol and beta blockers, all sorts of drugs that I take, and I hate them, and I stop taking them because the side effects are brain fog and exhaustion and things that I don't want to deal with when I'm a single parent working and trying to raise a family. So fast forward to several years later, I'm on HRT, and I notice, oh, I don't have these PVCs anymore. What I was told back then was that these PVCs were psychologically induced because I had just gotten divorced. I had just gotten my uterus out. I had to move. I was single parenting three children, one of whom was 7 years old. All these things that were life stressors, which, by the way, I can handle. It wasn't like I was that stressed out, but I suddenly saw myself as someone who was incredibly stressed out. And I saw that, there was a self-perception issue too, like, oh, I better not be this stressed out. Again, fast forward to, whenever I started taking HRT and I noticed the PVCs are gone. And I thought, well, I've moved on in my life. I have a partner that I love. My life is much calmer than it was back then. It must be the lack of stress. Well, then last week, I was on vacation with my mom. I went to my mom's house in Delaware. I forgot to bring my estrogel. And for a whole week, I was not on the HRT. Actually, 10 days, I was not on HRT. By the end of that week, the PVCs were so strong, and my hot flashes were hitting me one after the other, that I thought, oh my God, I bet that this estrogel has been keeping me from having those PVCs. What do you say about all this?
First, again, I'm not a cardiologist,
Sure.
but I've read extensively about menopause. Uh, we have to divide the conversation into at least two parts. The first
Okay.
is for someone to say that you're upset and you're under a lot of stress is unfortunately a common refrain when you're dealing with women.
Right.
As you know, the word hysterical, which
Yes.
refers to women, comes from the Latin word for the uterus, which doctors believed wandered all over the body, not staying in the pelvis, and that caused women to become crazy or hysterical. And unfortunately, that kind of advice stems from that prejudice, which I obviously object to. Second, palpitations, which are either a fast heartbeat or an arrhythmic, an out of rhythm heartbeat, can be due to several electrical heart conduction abnormalities. The most common are PACs, not PVCs.
Mhm.
PACs are premature atrial contractions. The atria are the small vessels. There are four small chambers. There are four chambers in the heart. The atria are the two chambers in which the blood enters the heart, and the ventricles are the large muscular chambers from which the blood is pumped out of the heart.
Mm-hmm.
And premature atrial contractions are occasional, irregular, extra beats in the atria. They are generally of no clinical significance unless they go to the extreme, in which case, instead of having a premature contraction, the atria, instead of beating regularly, just flutters.
Mm-hmm.
And that's called atrial fibrillation.
My mom
That
has.
is a
Yeah.
potential problem,
Yeah.
and that has to be addressed. But premature atrial contractions are ignored, and that can sometimes be due to stress or can be due to who knows what. And as long as we see that it doesn't cause anything, I try to avoid making a value judgment on the emotional health of the person coming to me with that complaint. Premature ventricular contractions are more serious.
Right.
Premature ventricular contractions means there could be something wrong with the electrical wiring in the heart that goes to the ventricle. And while atrial fibrillation, where the atria, instead of beating occasionally, irregularly, just flutter, is a condition you can live with. It just has to be addressed and you avoid the complications. Ventricular fibrillation is lethal. If
Yeah.
you develop ventricular fibrillation, you die.
Right.
And so premature ventricular contractions are treated much more seriously than premature atrial contractions. If your physician was certain that you have PVCs,
Yeah, she
I,
was certain.
I would like a cardiology evaluation just to see if there's any underlying sensitivity that would make you open to that kind of problem. That doesn't mean I'm not looking to worry you, and many times it's nothing. But unlike a premature atrial contraction that I would ignore,
Mm-hmm.
I don't ignore PVCs.
Right.
The fact that the PVCs were cleared when you went back on estrogen together with the other symptoms of menopause is very reassuring,
Yeah.
but it wouldn't prevent me from saying, I just want my cardiologist or a cardiologist to check this out and tell me that I'm okay.
Well, ironically, I just wrote the cardiologist yesterday a long email saying, "Hey, by
Yes.
the way, the PVCs are gone. It went away when I went on estrogen. I had no thought about that the two were related at all until I read your book and until I realized that last week I was having PVCs all over again. And the minute I got home and went back on my estrogel, everything's gone again. I'm fine. No more hot flashes, no more PVCs. My body feels in homeostasis, right? It's not going crazy.
Okay.
So,
I'm
I'll
pleased
see what she
to hear
says.
that. Yes, right.
Oh my goodness. Well, Avram, I really, really appreciate your help sorting out myth from fact, from rumor. And if there's anything else you want to talk about in terms of um, HRT and the heart, um, I don't know what else to ask at this point. Or is there something else that I've missed?
Well, I think it's important to recognize that one of the strongest motivators for people to invest in hormone replacement therapy, both physicians and lay consumers, is that hormone replacement therapy decreases the risk of serious heart disease by 50%. That's incredible. Why is it incredible? Because 7 times as many women die of heart disease as die of breast cancer. And most women don't talk about heart disease,
Right.
but they do talk about breast cancer.
Right.
And when I say that, what women say to me is, well, old people die of heart disease and young people die of breast cancer. And I know I'm going to die, but I'd rather die when I'm old than die when I'm young. In point of fact, in every generation, in every decade after 40, a woman's risk of dying of heart disease is greater than her risk of dying of breast cancer. And that difference increases to the point, if you look over women over a full lifespan, 7 times as many women die of heart disease as die of breast cancer. And in 1991, Lee Goldman, who at the time was at Harvard and who subsequently moved to Columbia and is the recent retired dean of the Columbia Vagelos College of Physicians and Surgeons. In 1991, he wrote an editorial in the New England Journal of Medicine saying, hormone replacement therapy to prevent heart disease, it's time for action, not debate. And that was based on extensive studies that went on before that. The person writing the article with him was Ann Tosteson, and Ann left Columbia, left Harvard, and is now a professor and director at Dartmouth Medical School. That was 1991.
Right.
That was 33 years ago.
Right.
And most women don't know the statements I just told you. And those are verified and obviously reviewed in the book, but they're reviewed everywhere. Nobody argues with those data.
Right. I mean, one of the other issues that women confront when they have to go on HRT is that it's extremely expensive. And when I say that I'm on estrogel, I'm on OESTRO, the estrogel that is sold overseas, because I found IsraelPharm.com, an Israeli pharmacy. First of all, they'll give you vaginal estrogen without a prescription, and it's much cheaper. But the estrogel is, a third of the cost as it is here in the United States. My Divigel, which I was on before, it went up to like $200, $300 a month. Who can afford this? And then I just read recently that Ireland is considering making all HRT free for all women, all Irish women. And I thought, well, maybe that's where I will retire then.
People, Carol Tavris, my writing partner,
Yeah.
whom you know, social psychologist and an inspiration, uh, said it's very important, since we are such strong advocates of considering hormone replacement therapy, it's very important to state in every interview that we are not on anybody's payroll. We
Right.
get absolutely no money from any drug, from any company, but certainly no drug company. And we object strongly to the exorbitant prices that are charged for these life-saving drugs. And I have nothing to say in support of companies that charge those high prices.
Yeah. Anyway, I'm going to press stop on the recording and stay on for a second because I want to ask you a few other things. Hold on one second. All right, stop recording.